Hey everyone, it's Tammy Tiller Hewitt, and we are so excited that you have joined us for our first Zoom roundtable for the Mid-America chapter of ACHE. And today I am so excited to have 4 of our member leaders from our chapter that are going to talk to you today about some of the experiences, the lessons learned, and the challenges that they experience within their organization related to this pandemic. And I think you all are going to find this super fascinating on a gazillion levels, but one of which we come from such a diverse group that you're going to hear it from so many different perspectives that I think this is going to be a worthwhile use of your time. Before we get started with the panelists, I do want to invite everyone to a 2-day learning event where you will be able to get 12 ACHE face-to-face credits on October 1st and 2nd. And as of right now, we're going to be holding it in O'Fallon, Illinois, and it's going to be a great 2 days where we're going to talk about quality and safety. We're going to talk about leadership, crisis management, and then more experiences learned by that time as we're hopefully on the full other side of this pandemic. So let's get started. Let's talk about our world as it is right now. But first, I want to go around the table and have our leaders introduce themselves, tell you what their roles are within their organization, and maybe a fun fact or two. Caleb, you want to start?
Yeah, I'll start. Thank you. Caleb Miller, serve as the Senior Vice President for Clinical Operations at Carle Health here in Champaign-Urbana. Been with the organization for 15 years, served in a variety of roles, have a clinical operations, strategy, business development background. Definitely love what I do. Fun fact, I was born in Jamaica, Illinois, and it's not near the beach.
That's a good one.
Yeah, and I also serve as the Mid-America Healthcare Executives Forum's president, not vice president, president of the chapter. I've done that for a couple of years now, and very excited about being here today.
Awesome. And he's a great president too, so awesome. So glad you're here, Caleb. All right, who's next? Christina.
Hello, thank you everyone. So excited to be with you today. I'm Christina Kearney. I'm the Chief Operating Officer for SIHF Healthcare based out of the Metro East in Illinois. We actually have 30 health centers, span border to border across the state of Illinois, and really have a diverse population of patients that we are serving. Been involved with the Mid-America Healthcare Executive Forum for a number of years. I serve as the chapter secretary and also assist Tammy with our programming committee as well, and do the communications and newsletter for the organization. So again, glad to be here. My healthcare background spans longer than the years that I care to admit to, but have spent a majority of my time in hospital and service line administration. Thank you.
Awesome. Okay, Jennifer.
Hi, I'm Jennifer Harris. I am the System Administrator of Perioperative Services at Memorial Medical Center and Health System in Springfield, Illinois and Central Illinois. So it covers 5 hospitals across Central Illinois, as well as some ambulatory offices that we have around the region. I've been with the health system for about 19 years in various capacities. My background is quality, safety, which dovetails nicely into perioperative services and everything that I do in this role. During the COVID pandemic, I was a planning officer, chief officer for our HIC structure, so I had some unique perspective and got to do a little bit more from that angle as well. And a fun fact for me is that I had my baby boy turn 16 while we were all in quarantine. So we were talking earlier about having new kiddos driving, and yes, it is very scary. But I'm happy to be here, and I look forward to this panel discussion.
We're so excited. All right, and last but not least, Jessica.
Hello to everyone. My name is Jessica Cataldo. I am a clinical instructor and internship coordinator for the healthcare management program at Southern Illinois University in Carbondale. At SIU, we have an undergraduate program as well as an MHA and MHI. So I primarily work with our undergraduate students, but I also work with residencies for our graduate students. So we've had some unique challenges with all of this going on that we're still trying to learn and grow from. I look forward to not only sharing our perspective from the academic side, but also learning from everyone to see how we can continue to grow that in an academic perspective. My fun fact, also kid related, I became a mother in April, so I was a very active patient throughout all of the pandemic response and had a very unique experience having my first child in the middle of a pandemic.
Wow. Wow. That's going to be something for the storybooks for sure. That's awesome. Congratulations. Well, my name, again, is Tammy Tiller Hewitt, and I am the president of Tiller Hewitt Healthcare Strategies. And we're a consulting firm that works with hospitals, health systems, and physician groups across the country to manage and operate their outreach efforts, their growth efforts. So we are very much into strategic growth. So we've had the privilege of working with hundreds of health systems, but during this pandemic has been a game changer, as it has been for everyone. But because we always say when you've seen one, and literally that's what's happening around the country, that everyone is doing it so differently based on their state laws, where they're at in the epidemic or the pandemic. And so it's been very fascinating. But being a part of Mid-America Healthcare Executive Forum has been a game changer as it relates to professional growth and camaraderie. It is an awesome organization. So I'm excited to start this panel today. So let's start with you, Caleb. Let's start with the first question that I want to ask is, what surprised you most throughout the pandemic?
I'll take a little different spin on that. It's surprising, but not surprising, but the just how effective we are as a society when we rally around something. COVID-19, pandemic was obviously a significant healthcare issue. But it wasn't just like the healthcare systems, addressing it. We had the public health departments, the healthcare systems. We've had to have compliance from our, local businesses, just the state governments, the federal governments. And I truly believe we've been effective in a lot of things. Obviously, things have gotten political at times, and, that's where we've hit roadblocks. But I've been pretty humbled and not surprised, but just appreciative of the overwhelming support we've got across those groups, because I think that's, at the end of the day, that's helped us save lives. I'd say the other thing that's been surprising, and it's not necessarily surprising, like the first point, but as healthcare leaders, we've got very complex jobs. And when we thought that they couldn't get more complex and dynamic, then a pandemic happens. And so with that, we've definitely learned from it. It just has really shown us that we really need effective communication, streamlined processes, innovative solutions, open-minded employees, and really a sense of teamwork to ensure that the care that we provide our patients is always at its best. So those are some of the things I think that's been surprising to see happen on such a consistent basis.
Wow, it'll be interesting to see if that's been the same experience for others. Christina, that's great stuff, Caleb. Christina, what about you?
I would have to agree with Caleb as far as the ability for teams to pull together, to rally around one another. So I started with SIHF Healthcare in November. So I had about 3.5 months under my belt in a large organization, and then COVID happened. And so luckily, as Caleb mentioned, the camaraderie, the ability to pull together and to help one another through a situation, or I would not have survived. So I said to individuals, it was a very daunting task to make decisions for health centers that I hadn't even had the opportunity to walk into because we're such a large organization. But having a great team, great health department partners, great regional support with the CEOs from our hospitals in the region, it really helped us pull together. I will tell you from the side of things that was difficult for us, that from the challenges that was a surprise, was the constant changing of the guidelines and the differences in the guidelines between state and federal and other professional organizations. And we just really had to set a decision-making process to say, Illinois Department of Public Health and CDC, we can't continue to roll in all of the professional organizations because we can't keep up with all the changes with that. And so making sure that we were keeping our focus and one scope, and then relying on our partners within our organization and our external partners really was what was able to help us to move forward and really to get ahead of the curve as far as the pandemic was concerned early on with the organization. So.
Yeah, all the rules changing day by day, sometimes hour by hour. It was maddening. It was maddening to watch awesome people just not lose their minds over, the constant change. So,
and from
Jennifer,
a leadership perspective on that, you have to be careful that your staff understand. You don't want to be pointing the finger, but you don't want them to think that your leadership lacks the skills to be able to guide them through a pandemic. And that was very difficult to do. But again, with a good leadership team, we were able, and good regional partnership, we were able to do that effectively.
I think it's going to be interesting as we go across the organizations, because I think that's telling of the relationship building pre-pandemic that existed to allow you to have that kind of pleasant surprise of the camaraderie and the teamwork, that Caleb, you started talking about. That didn't happen in a lot of organizations that didn't have strong, physician-hospital relations, community relations. They were trying to build relationships with people they didn't even know at the same time. It was almost like, building the plane as they were flying it. It sounds like you guys had that in order, which helped you, get a lot further ahead faster. Jennifer, how about you? Talk to us about kind of what surprised you throughout the pandemic.
It's right in line here. What I was going to start with was the sheer volume of information and data and the rules changing every day, every hour, and then trying to figure out how to sound logical and trustworthy, with everybody as it starts to get rolled out. Because just as you roll something out, the frontline clinicians are asking why we're changing it again. So just staying on top of the sheer volume of information that was coming out. We had daily briefings that were going out to our medical staff, to our staff, to the community, trying to stay on top of all of those changes and being able to explain it. And I don't think I'm unique, but how many times did we have to have just one-on-one conversations with people to answer questions and work through the logic of how IDPH or CDC came up with that rationale? We may not have agreed with it or understood it, but when you saw the reasoning behind it, it started to be clear and make sense to everybody. But I think that was the initial challenge, was just as the data and the disease progressed, we learned more. But how do you keep everybody on the same platform and moving forward? So that was the most surprising to me, because in all these years, I've never experienced something where we had that many changes going on constantly. It's not surprising. It's just I personally had not been through it, and I know that was a challenge for everybody as we move forward. I think another surprising thing for me, though, was it was very neat to watch was the natural leadership that came out within individuals throughout healthcare. In the communities as well. But within healthcare, I used to teach a class similar to Jessica, with undergrads on emergency preparedness. And I always said your ICU nurse is a perfect example of somebody who could be a great incident commander, because they know in a code situation how to be calm, focus on the task at hand, navigate through all of that. And you saw those same behaviors coming out in our leaders throughout this pandemic. So it was pretty cool to see people step outside of their comfort zone or their daily job of what they do and take on a whole new role related to COVID, but you could see those leadership skills evolve, and that was really, really neat to watch happen. Likewise, there were some people who were not as comfortable. It would step back where you just knew they couldn't handle it. It would cause too much anxiety and overwhelm them. So you just knew it's okay. Let's move over here and you take this role, and we'll shift where people are in their positions. But that was surprising to me. It was really neat to watch people develop as this all went on.
Yeah, so a couple things you said, that once you, even as a leader, understood the why behind some of these constant changes, it was a lot easier to adopt and sell within your organization. I think that's a lesson that we always have to remember. It's so much easier to get people to get our stakeholders, whoever they are, employees, physicians, whatever, to buy in when they get the why. And I think that because of those changes, I felt like everyone prefaced every conversation they had with everyone with, well, as of this moment, and then they would go forward with whatever was happening. And then I like the way you talked about how people rise to the occasion. And that is awesome to watch. You know, as leaders, we're always looking at, you know, who's coming up to replace us, and to see people to really step up. And then also to have people, when they openly say, this is too much for me, you know, I'm like about to lose my mind. So it's nice if they step back, at least they get out of the way and not try to fake it till they make it, and making everybody else crazy at the same time. So awesome. So Jessica, you're going to put a whole different spin on it from an educational perspective. So talk to us about what surprised you from an academic perspective.
Well, it was a bit different for us in the academic world, because while things were ramping up for you, they were almost coming to a halt for us. I mean, we shifted everything online, but we were really kind of stuck in this, just trying and maintain kind of float without really gearing up a whole lot for changing things. What made it nice during that, honestly, for our faculty is it gave us a chance to kind of reflect, because we were halting. We weren't ramping up as everyone else was. And one thing I jotted down in our reflection is that this competency area of managerial epidemiology has been on the discussion block at the undergraduate level as to whether or not it should really still be in the curriculum. Should we maintain this epidemiology focus, or should we shift more to population health, value-based reimbursement? Are these skill sets still relevant? And I think this pandemic really highlighted that maybe we don't need to put as much focus on it, but students need to walk away from their academic program with a basic knowledge of epidemiology. If you're going to be working in healthcare, you have to understand how disease spreads, how we stop disease, how we respond to, pandemics such as this one, emergency management, as Jennifer talked about. And those things are within our curriculum right now. So it was almost confirming for us that we need to continue the curriculum as we'd identified, and not shift away from those things that has been discussed in the past.
Interesting. Before we go to a next question I have for you guys, anyone want to come back or share or respond to anything else that your colleagues had to say? No? Okay. All right. So I want to talk about what has been the biggest challenge. So we talked about biggest surprises. Now I want to talk about the real challenge, whether it's related to literally caring for COVID patients or reimbursement, or whether it's all the way to opening back up. But I would really like to hear about, maybe it's two phases. It was biggest challenge as it relates to the outbreak, and then biggest challenge related to preparing for your recovery and relaunch efforts. So we'll start with you, Caleb.
Yeah, I'll talk about a few of those. Caring for patients, I'll say the actual caring for patients has gone really well. I think that's a testament to our talented medical providers, the nursing staff, support staff that we have within our system, and I'm sure that's the same case for many of the systems that we have representing here today. We've seen some pretty amazing recovery stories. We've seen patients coming in they're extremely sick. They get put on a vent. They're sitting in our ICU for multiple weeks, and you're just waiting to see kind of as our updates are coming out when this person starts declining, and then them obviously passing away or leaving the system to go on hospice. But we've seen we had an individual that was within our hospital for well over 5 weeks, and ICU vent the whole day, and then he's walking out 2 weeks after that. So it's pretty amazing stuff that's being performed, and it just really shows the talents of our group. The challenge with caring for patients has been pretty evident. Those always been centered around workflows, testing, communication. We talked about communication a lot. As soon as we got something out, it was like, all right, we got to reverse course on this, because that's not the guidance that they really wanted to kind of get across the the state or CDC. Reversing course, that could be a day later, that could be a week later. It was just constantly changing. So I'd say that's probably the biggest challenge. Opening back up, this was a challenge, and I think we've done it pretty effectively. But we educated our patients for a number of weeks, probably, 2 months straight of, if you're sick, do not come to the hospital unless it's for emergency situation. If you're, just got, feel like you got COVID symptoms, bunker down, we'll test you if you come in here. But if you're at the very beginning, if everyone remembers, it wasn't about testing because we didn't have the test available. So we weren't asking people to come in, and then all of a sudden we want people to start coming in to get testing. And now we want everybody to come in to get testing and everything else that they're expecting to be, that they should be getting, just to be able to maintain their health. So our biggest challenge is re-educating our community around that, particularly that our organization is a safe place to come receive care. And that's not to say that we're doing anything unsafe. It's just that people have, they still have this thought of, I go to the hospital or I go to the health clinic, I'm going to get COVID. When really it's probably one of the safer places in the community. It's a lot safer, I'm sure, than the grocery store and other places, just because of everything that we have in place. So that's been a big challenge. I think we've done a nice job. We collaborated with our marketing team, our promotions team, to really get out to the community, have those conversations in all those different mediums that we can. Really educating our patients. Those are direct communications, directly emailing them, saying these are the things we're doing, this is what we're going to be doing, so you're coming into a safe environment. But that was not without challenges. I think we still are kind of rebounding from that. I think it'll still, we still aren't fully back as it relates to like pre-COVID volumes. I think, and I don't know if we will be in certain aspects of the services that we deliver, but that's probably been the biggest challenge.
So I'm curious on your patient communication on the emails that you're talking about. Were those only to patients who were previously scheduled for something, or everyone in your database?
Everybody in our database. So we took the opportunity to, we obviously, everybody that was scheduled, when we were taking them off, it was communication on why we were doing that, who we were keeping on the schedule, who we were going to add back to the schedule and when. And then as it relates to we took basically our whole patient database, and we seen them as an extension of our staff, and whether that be providers or our frontline staff, that all the education we were providing to them, we wanted to say, how do we do this from a community perspective? How do we make sure they kept updated on the different things we're doing? We obviously did not get into the level of details that we did, but we needed them to know that as you're coming to the facility, these are the expectations of you as a patient. Obviously masking up. This is what you're going to see when you walk that door, the forward triaging, all those different things. We want to make sure that they felt comfortable and they really understood what to expect. And that's kind of, that's patient experience 101, set the expectations, make sure they understand it, make sure that it's all focused on them. And at the end of the day, I think we're pretty effective with that.
That's awesome. Because that really serves as a marketing communication as well, just to remind them, hey, we're here and we're safe, even if they weren't ever planning to come back, So that's awesome. That's everyone.
Yep.
All right, Christina, thank you, Kayla. That's all good, great stuff. Christina, is your situation a little bit different given you have 30 outpatient? Are those 30 FQHCs or?
Yes, 30 FQHCs. And so our challenges are a little bit different, but similar. So I think we have the same challenge, maybe different reasons behind why the challenge is posed. So definitely communication to individuals, definitely a concern with people not wanting to come into the health center, and also a concern with us not wanting to expose individuals within a health center. So we did many of the similar things that Caleb is talking about. So we implemented communication directly to our patients. We began our planning for this in early February once we started to hear about it and determine who should be coming into our health center. How can we handle some of the changes and challenges that we're dealing with? For an FQHC, one of the requirements that we have is that we have to do face-to-face encounters. So we really needed to work very quickly to ramp up a different method to care for our patients. But it actually turned out very well for us because our patients were scared to come into the health centers to begin with. So for us to be able to convert to telehealth visits and do that on a very quick basis and be very nimble with our patients really helped us out and helped us to maintain that communication and that connection with our patients. With our staff, also looking at the communication and some of the things that we needed to do there. And as we've talked a couple different times about the changing needs, the changing communication. So we implemented daily briefing calls system-wide that included staff and providers so that we could talk with them about what we were dealing with and what the expectations were and what the guidelines were at that time. Also dealing with our leadership staff and making sure that we had communication with that group of individuals as well so that we could implement the changes that were necessary on a very quick basis. So again, a daily communication. And of course, with that group, you know, it's your leadership staff, you can laugh a little bit more. And so I recall one day I started the conversation and said, okay, welcome to today's edition of Let's Change What We Implemented Yesterday, so that we can go ahead and get things going for our teams. And so really that became what it was about, and just making sure that we were able to be nimble and put things into place for our staff and our patients to be the healthiest that we could be for our patients as we were dealing with them there. And making sure that we have email communications that were going out, putting the guidance and the protocols in place, understanding the documentation, understanding why we needed to do that. So I would say our communication was a challenge for us just because of our sheer size and the fact that we were not all within one building. So making sure that we had the communication and the technology in order to communicate across the organization.
I'm curious how many telemed visits you had pre-COVID and how many you've had since the outbreak.
None. We had none pre-COVID because as an FQHC, it was very challenging for us to negotiate and navigate some of the requirements for a face-to-face visit. So I would say in one or two health systems, we had a couple of distance visits that were going on, but they were minimal. Now we are seeing where our volumes are down about 20%, so 80% of our visits that we have are still occurring. And of those, 90% of those visits are televisits.
Wow.
We have seen the most success in our behavioral health components. And our behavioral health has been a bigger need probably than what we had before. And because we were able to remove some of the barriers for patients, those service lines and those providers have seen an increase in their volumes, not a decrease. The areas where we've seen a decrease in volumes tend to be our dental services that we offer because we were only able to go to emergency services for about a 2-month period of time. We've seen a decrease in our pediatric volumes. The new moms don't want to bring their healthy babies in and be concerned and worried about the environment that they're going into. And our OB patients and GYN patients are, again, the three main service lines that we're seeing a decrease in patient volumes for. But all of the others were able to effectively do a lot of things via the telehealth moving forward and for our patients.
So do you know what your count is right now to date, what your telehealth? I'd just be curious from zero. Yeah.
About 4,000 a week.
Wow.
Yeah.
Wow. That's a shift.
So that was
That's
one of
awesome.
the things that was great. And so, you know, making sure that we had the technology, making sure that we had the team with that. And so that was our early challenges were to get that going. Some of the challenges then that we faced midway through. So as Caleb indicated early on, testing was not the focus. The focus was stay at home, stay healthy. Let's continue to do what we can do for you via the phone, via video, via whatever mechanism we need to where you're not in the health centers. Then in early April, that focus shifted so that we could start testing individuals. And so as an FQHC group and having a large footprint, particularly in the Metro East, our elected officials looked to us to set up testing centers for them, which was phenomenal. Unfortunately, the communication, as you know, sometimes doesn't go in the method that you would like it to go. So one instance, we found out that we were going to be a testing site in a community from the mayor of that community on a Facebook Live. So this was a Thursday afternoon where on Facebook Live, it was announced that our organization was starting testing on Monday. And this happened to be our first testing site that we were going to be opening up for them. And so we had no clue. So we really had to scramble to get things in place to be able to put this together. But we were able to do that in such a manner where we created a centralized call center. So early on, we had a very stringent set of requirements of who could be tested. So we were tasked with getting testing available to an underserved patient population that met a certain criteria. So we were able to set up a medical screening hotline for patients to call. We were able to set up a drive-through testing location for individuals to come in. And what I said to my team when we first learned about this is, after the moment of panic has resolved, when you hear that you're going to do this, it's a tremendous sense of pride to know that your communities and your elected officials have that faith in your organization. They have that confidence in you. And then at the end of the day, we were able to deliver that to our community. Since that time, we now have 6 testing sites. We also have 1 mobile unit that we are deploying testing. And we've been testing for about 30 business days. We have screened over 3,000 patients for testing in that 30-day time frame, and are only going to continue to increase that now that the testing requirements are starting to relax. So that was our midterm when we started to get comfortable, what kind of got us out of our comfort level. And of course, now what we're dealing with today is the phasing in or the reintroduction of patients back into our health centers, and doing that in a mechanism and a manner that is safe for individuals. The level of anxiety that exists around this pandemic is still very high. And so as we start to reintroduce individuals face-to-face back into our health centers, we want to make sure that we're taking actions and initiatives that are good not only for today, but for long term. We know that COVID-19 is one of the infectious diseases, the biggest concern of arguably our lives. Let's hope we never have a repeat of anything like this again. But this is not the only concern to health and to the disease process, and that can create concerns for our patients as they're coming in. So we're looking at this on a long-term basis, and hopefully as an organization and as an industry, we'll start to look at the positive components of it and carry those forward. And I know we'll talk about those a little bit later as well. So
yeah, yep. Okay, wow, that's a lot of good stuff. So was that, I'm just one question and I'll move on, sorry, was the Facebook Live on Friday and you went live on Monday, or how many literal days did you have?
Thursday, and we went live on Tuesday. So we had 3 business days. Yeah.
So you didn't sleep that weekend, is that what you're saying?
No sleep that weekend. But,
no sleep. Yeah, who needs, it's so overrated, right, Jessica?
Right.
The new baby? Yeah. All right, Jennifer, you're talk to us about your biggest challenges related to patients, or whatever your area of biggest challenge was.
Sure. I echo a lot of the same things that Caleb and Christina have said already, so I won't spend too much time on those. But I think at the very beginning, healthcare has never really shut down or limited, especially in the United States, our services. So at the very beginning, I will never forget that first day back in March where we had to have the conversations about how do we shut down elective surgeries, how do we start shutting down some outpatient services that are not urgent emergent. And that's a really hard conversation, and we really struggled at the very beginning because we've just never dealt with that. We expand, we grow, we might close and reopen or resize, but we've never faced this. So, very early on, it was just a matter of how do we handle this as a health system? And then as things started to go along, again, I won't go through everything that Christina and Caleb already said, but it was just innovative things that had to come up. How do we have screening? How do we do forward triage in the ER? So how do you triage outside before you bring them in? I remember seeing our engineering facilities guys built over 20 bays outside of our ER, or in the ambulance garage. And I remember going out there that night, and it was just unbelievable to me that in America, in central Illinois, we're building forward triage outside. And so to be able to be agile, but bring that all together. So, very early on, those were all just foreign to us, and we had to work through those challenges. I think, everybody feels pretty comfortable with those concepts now, and we have them on our shelf So if we ever have to get them back out, we know how to do it. I think the interesting thing now is that we accomplished that. We've made it through the peak, hopefully, and we're coming back down for the summer. But as we start to look into the fall and the winter before the vaccine comes, what happens as we're resuming services now, to what Caleb said, to make the patients feel safe, because we are probably one of the safest places to be in a community right now. But so that they come back for their preventative medicine and treatments. So colonoscopies, for example, are patients going to come back for these elective procedures, or are they going to choose just to do an at-home Hemoccult kit, instead of coming in for the actual colonoscopy? We're watching how the patients in the communities and just medicine in America is changing a little bit to this whole COVID pandemic. Hopefully, everything starts to rebound and come back to what it was, although, we have to be cautiously optimistic to that, that it is changing. We have more telemedicine now, which has been phenomenal, but that does change what's coming into our physician offices, clinics. And then as we go into the fall, like I said, we have to be prepared for how do we maintain a safe environment, ensure that everybody feels safe and comfortable, and we are ready from an operational standpoint to maintain those urgent, emergent things that go on within a hospital, but also continue forward with the preventative medicine and treatments while COVID might still make a reemergence. So again, I feel like we lived through this. It started in March. I can't imagine if we go into the winter months, though, how do you do forward triage when it's literally 0 degrees outside? These are all different things that we started with in March, but if it really comes back or reemerges, are we planning for that? And learning what we've learned in the past 3 months, how do we prepare for this coming winter or the next emerging disease that may come out of the next situation? I think we've learned a lot, but those are just a lot of challenges we have faced here. I know our facilities guys are very adept now at how to take an entire nursing unit and make it negative. To them before that, that's completely foreign. They can do 1 room at a time, right? We're all very good at that. But to make an entire unit or 2 or 3, very different. And then even as a health system, I said at the beginning, we have 5 hospitals, all the way from a critical access hospital to Memorial Medical Center, which is 500 plus beds, a burn unit, level 1 trauma. We had to learn as a system how to help each other out with this so that we weren't 5 siloed hospitals, but how can we help each other out? So maybe we took those critically ill COVID patients from some of the smaller hospitals, but they have swing bed or transitional care units where these patients could go back and get the appropriate rehab or rehabilitation before they discharged home. We really had to talk through how do we do that as a health system. It was pretty fascinating, and it was great for patient care, so really proud of that work. But again, carrying that forward changes how we do things on a routine basis. So a lot of great challenges that I think a lot of positive things emerged from, hoping that we can continue those innovations and that momentum even as we go forward with everyday life. So
yeah. Well, you're right. It's heartwarming to know you can do it when you have to do it, because now you've all seen it happen. So is there preparation, though, moving forward to playing the what-if game? You can't flip a switch back on, but to be able to say we need them built again with heaters this time. And
yeah, absolutely. I mean, a big part of what I focused on, again, in that planning role was resources. So we haven't even talked about all the respirators and medicine shortages and et cetera, but the resources, the people. We had to redeploy people, as everybody did, to different units and different roles, and physical space. What are your physical space requirements? And so those 3 key areas are what we focused on when we were upscaling to this pandemic, what we are in the middle of descaling, to go back to normal operations. And what we're working on right now is how do we make that blend so that we can pull it off the shelf and we can move forward should we start to have a rise again in COVID cases in Central Illinois. So yeah, we've learned a lot from it. It's just finding that now.
Yeah, well, I think, and I loved hearing how you learned how to even work better. I know we talk about teamwork, but when you're thinking about, multi-hospitals and, trying to, we saw in some markets where for a while until they kind of woke up, it's like, oh my God, we're competing with our own hospital, hoarding our supplies. It's like they need some too, like they're mine, all mine. So.
Yeah, we get very, very good at pooling all of our resources to that point. I mean, I can tell you exactly how many N95s as a health system we have and what the burn rate is at each location. And that's pretty powerful, even going forward.
Wow.
So.
Yeah. Wow. That's cool. So are you guys on a hospital side? Are you guys prepared for a baby boom in 9 months?
We talked about that. Yes. I think everybody's bracing for that. We'll see what happens.
Yep. I mean, I've already seen a couple examples of people making the announcements, and I'm reminded every time, like, hospitals, you better be ready.
Yes.
Okay. Thank you so much, Jennifer. Jessica. Oh, was someone else going to say something, or was that Jessica?
Oh, I was just going to say, I know that our OB is one of our volumes that have been down, and our providers have been a little worried, and I'm like, don't worry, you'll make up for it in a few months. It's okay.
Yeah, exactly. Okay, Jessica, from an academic perspective, biggest challenge?
The biggest challenge for us has really been around the internships and the residencies. So, obviously with all of this going on, organizations have to limit who's coming into their organization. And so students got stopped from doing their internships or residencies fairly early in March. Especially for our undergraduate students, majority of the students are out in internships in the summer. We had to come back to the drawing board and go, how can we still give students that kind of capstone, accumulating experience rather, without having them actually be at a facility in an internship. So one of the options we came up with, which will actually start next week and we're excited about, is a COVID class. We started a case-based class for students to take to be a kind of a learning, a hands-on experience, case-based learning with guest speakers to understand how people responded to this and to give them the opportunity to think through what would they do, right? How would you respond in this situation that facilities faced during this pandemic, and then hear what people actually did. So that's been, I would say honestly, the biggest challenge, and I would say the most frustrating for students is to not get those opportunities in internships, but still make sure that they're walking away with that hands-on experience that they need.
Jessica, do you feel like those have opened back up now?
So we've been communicating with our most common internship sites. Some are looking at potentially having students back in August. Others have already said that they won't have students back until January 2021. So it's a little bit all over the place still, probably depending on the level of outbreak that each community has experienced. But we're hopeful that we'll have at least some students able to return in August.
Okay.
I heard that about medical students too, that they're not allowing them to shadow in with surgeons. Did you guys have that stop at your organization?
When we did, for our College of Medicine, we shut her down for a little bit. That was the first thing we brought back, just from a prioritization standpoint. And then we've also found creative ways to still get them those learning objectives and get those things, in just different formats than they had previously. So we definitely shut it down initially. It's back, doing it just in a different manner. And that we're doing across the board with all our students, whether it be APPs, CRNAs, surge techs, across the board. We're taking a different approach to it, but we're also trying to bring a lot of them back because we know that's one of our biggest pipelines for recruitment. And, just really maintaining our healthcare services for everybody else that's not dealing with COVID.
Well, not to mention what a great opportunity for them to learn. I mean, if we bench them during this crisis, and then the next one comes when they're full-fledged doctors, administrators, whatever, they missed out.
Absolutely.
So that's good that was a priority. A priority.
We've had 2 master students who've still been able to be in their residencies at this point, and the learning opportunity that they're gaining is just unmatched. To be able to be just soaking all this in without the pressure of having to go through it, it's a pretty unique experience for them.
Yeah. Okay, well, as a final question, I'd like to ask you guys what you think that you learned during the pandemic, during the pandemic, that will become a new norm, or you're definitely going to adopt some fashion or part of it in the new reality. Caleb, you want to start?
Yeah, I think the key will be to learn how our patients' expectations have changed from this as their healthcare provider, and how are we going to address them. I think it's also to be able to, create better processes, better plans to be able to obtain that information so we can react quickly. We fully expect to see our patients come back and seek our care, but it's not going to be the same, so we know that. I don't want to say telemedicine is here to stay, but I'd say innovative medicine is here to stay. It's going to come back in some form, or it's going to be here in some form. I think that will change a lot. I don't think we're going to see everything stay telemedicine, but I think we're going to see a lot of it. And I also think it's just going to be, and that ties back to patient expectations. I think there's going to be expectation to receive care in a more patient-centered fashion than it has ever before, I think we've created some of that, which I think is a great thing. I think the last thing is like we got to accept that we're going to have another pandemic, and the nice thing is while this has been very challenging, it's been very complex, it's been long hours, it's been a lot of mistakes along the way, a lot of great things we've done along the way, is we're going to have another one of these, so we need to accept it. And the nice thing is from all those experiences, we're going to be better at it and more prepared. We obviously had H1N1, Ebola, everything else in the past. This obviously, I think, takes the cake compared to everything we experienced with that. But yeah, I'm sure we'll have another situation like this. It might be bigger, it might be smaller. But no matter what, the experiences that we've had is going to make us better for it and better to approach it the next time around, because it will happen.
Yeah, well said. We won't be so shocked. Christina, how about you?
I definitely agree with Caleb that the innovation is here to stay, and really looking at how we now deliver the services that patients are expecting. We have a really unique and wonderful opportunity to redesign our industry, and as long as we're taking the positive components of what we learned in this and moving them forward to benefit our patients, I think we will all be better for this, and we will be better prepared to handle the next pandemic or epidemic or whatever comes to us. And really looking at the innovation of using technology where it's available, internally and externally. So I know a number of organizations are already very nimble at using technology, but what we learned is that there are a number of individuals that are not. And Zoom and Doximity and a lot of these mobile platforms for video and electronic communication have really come to the forefront. And those organizations who haven't already been using them have now been pushed into that environment. And I think we can see that as an area to easily mobilize our organization and our workforce in the future. I think this will bring additional changes to the footprint of medicine. We may not go back to having waiting rooms full of people. We need to look at different innovative ways to social distance beyond what we have ever done before. We may now be looking at it from an employer standpoint of recognizing positions that we can now allow them to work at home where we didn't have the proper mechanism to do that in the future, in the past. And going forward, I think these will be great recruitment opportunities for us into the healthcare environment and good ways to satisfy some of the work-life balance that has been a challenge in our industry for quite some time. So I think there'll be a lot of good learnings for us and an opportunity to really reshape the industry, both from an employer and consumer perspective of things. And so from that component, it's a really exciting time to be in the healthcare industry.
Man, you guys, this is good stuff. Good stuff. All right, Jennifer, you're up. What is the lesson learned that we're going to carry into the new norm?
Tough crowd to follow here. Okay. I honestly think that it has made us even more agile in healthcare. At all levels, for a long time, we got very stuck, I think, and stagnant a little bit with this is the way we do it, or we've always done it. We do it because of regulatory, et cetera, et cetera. And this really forced everybody to stop and learn how to collaborate, work together at the turn of a dime, get innovative, figure out how we're going to move forward. And we're still having to go through that, as we're coming a little bit out of this and back to normal operations. But I think it's given us the ability to be more agile than ever before, which is pretty neat to see the outcomes, as Caleb and Christina said. I hope we carry that forward as an industry going forward. You know, just for example, I don't know about you guys, but my calendar, all the unimportant meetings somehow went away, and I don't feel like things were missed. You know, life went on, right? So little things like that I think were a really, really good positive out of this, just the agility. And as I said at the beginning, the ability for a lot of people to exercise new leadership skills, develop new leadership skills, again, whether it's frontline clinicians, physicians, you know, formal leaders. I think it gave everybody a once-in-a-lifetime experience that until you live through it and experience it, you can't forget it, and you're going to carry it forward no matter what. And so I think that's been a huge positive to this entire situation as well.
Awesome. 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 Okay, Jessica, you're going to wrap it up for us. What were lessons learned that you're going to take into the new norm?
Perfect. Well, I think one thing that this pandemic did for us is remind us the importance of incorporating soft skills into the curriculum. The content knowledge is so important, but the ability to apply that content knowledge effectively is equally, if not more important. And so as all you were talking about, the leadership skills, the ability to be agile and flexible, those are skills that as educators, we also need to be preparing our students for as they, you know, leave into the real world. So I think it's been a reminder that those things can't be forgotten in the curriculum as well.
Awesome. Well, there you have it, from the mouths of 4 awesome leaders within our Mid-America chapter. Thank you to each of you for some very insightful. I know you have the battle scars, and you're all going to write a best-selling book from your experience, and I'm going to be the first one in line to buy it. So hopefully you all have enjoyed this roundtable discussion, and we hope to see everyone on October 1st and 2nd for our 2020 Mid-America event. Thank you so much.